Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome David Cundiff. He is a physician, author, and health reform advocate. Today's Kevin MD article is Accountable Care Cooperatives, a community-owned healthcare fix. David, welcome to the show.
Thank you very much, Kevin. I trained in medical oncology and hematology. And during that training on a trip to England, I did rotations in 3 hospices in the late 1970s and decided to be a hospice doctor instead of a medical oncologist. And after my training at Harbor UCLA Medical Center Cancer Ward chief on a small hospital, the hospital closed down and I was transferred to LA County USC Medical Center in East Los Angeles, one of the biggest hospitals in the country at the time. And within 6 years, I was able to start a hospice consult service. However, in 1995, the Department of Health Services had a crisis in funding and closed our hospice consultation service, which was costing about $9 million a year in lost revenues from having patients at home, and wrote an op-ed to the LA Times that outed me as a whistleblower. And the hospital and the medical and the Department of Health Services retaliated and charged me with malpractice. I went to court and I had an attorney and lost both the job and my medical license. That's a long story of how that developed. In any case, I got to do what I wanted to do, which was to write about healthcare in the United States and how it could be better. So I wrote Money-Driven Medicine, Tests and Treatments That Don't Work. Physicians face a perfect storm. We have crippling administrative burdens, loss of clinical autonomy, and insufficient time with patients, much worse than when I was practicing medicine. The predictable result is a workforce pushed to the brink by burnout and depression. Healthcare funding is the crisis rather than what is now happening to patients and healthcare providers all over the country with our failing system. The harm is done both to patients and providers and remains secondary in concern to politicians and decision makers. However, as former White House Chief of Staff Rahm Emanuel famously noted, crises create the political space for solutions once considered impossible. And so, with the frustration among patients and healthcare workers reaching a breaking point, the atmosphere for meaningful bipartisan reform has finally arrived.
Well, one of the solutions that you talk about in your article is accountable care cooperatives, a community-owned healthcare fix. So just briefly summarize that article, and we could certainly talk about some of the implications of that.
Okay, so the article is looking at first the failure of our current healthcare system. And I think there's probably a consensus among healthcare providers and patients that something is the matter with it. Certainly, it's out of control in funding, and that's what's brought it to the crisis status with the shutdown of the government. And so now is the time to do something about it. And there needs to be a really good plan. The Republicans and the Democrats in Congress are just quibbling about non-consequential things, really. It's the whole system that's failing, and the whole system needs to change. We need to not have all these public and private insurance schemes, but to replace them by what I call accountable care cooperatives, which are private, nonprofit, government funded largely, competing cooperatives that are taking care of patients and are guided by people in the cooperatives, administrators from the cooperatives, which would be in the range of maybe 1 million to 10 or 20 million people in a cooperative. So maybe 2 to 5,000 cooperatives in the whole country. And they would be self-regulating. So no more Washington, D.C. and Congress, telling doctors how to practice, but the doctors would in the various cooperatives make their own regulations and be accountable for the outcomes from those regulations. So that would be another way that we can see what is working and what isn't working. Our system now of having randomized trials to decide what drugs and treatments are used in medicine, has its role, but it's failing in a lot of ways because drug companies and device makers and other influences are controlling what a doctor can do and can't do.
So,
Okay.
to summarize with these accountable care cooperatives, you're recommending that we reorganize the entire healthcare system into thousands of these cooperatives. Just contrast how a cooperative would be different from, say, an HMO, large academic medical center that we have today.
Okay. So HMOs and large academic centers are all constricted by Medicare, Medicaid, veterans, all these different public and private insurance companies. And doctors have to go by the guidelines from whatever system they're in. They're not autonomous anymore. And this impacts patients as well, the lack of autonomy of physicians and the governance of Washington, D.C. and politicians in how physicians practice. So this is leading us to a crisis over the next decades because the healthcare system that is failing us is also increasingly costing way too much money. It's predicted to go up to about 40 or 50% of the GDP by the Government Accountability Office. So something has to change.
So, with so many cooperatives, do you envision any type of standardization? You mentioned that these cooperatives function independently, but how could we ensure that the care given by one cooperative is consistent with the care given by another one across the country?
Well, you don't have to have consistency in the way that the cooperatives do and don't authorize tests and treatments. That's one of the beauties of it, that the differences between the cooperatives will be transparently apparent because you keep records on the patients and what interventions they're given and aren't given, and you see what the outcomes are that way, which you can't do with the current system because everybody's under the same government guidelines and insurance company and pharmaceutical company dominated guidelines. We need different guidelines, and they can develop organically from competing nonprofit, self-regulating, accountable care cooperatives.
And you mentioned that each of these cooperatives operate under a capitated global budget, right? So that's similar to what HMOs did back in the 1980s.
That's right. That's right. But that capitated budget is going to be much more efficiently implemented because right now in healthcare, the incentive is to get more money out of the government in providing healthcare, filling hospital beds, and having more tests and treatments that are paid for by pharmaceutical companies and so on. But accountable care cooperatives is shifting the incentives toward efficiency and value and outcomes of the healthcare system.
Are there any places in the world or any countries that use a model similar to what you're proposing?
Nothing is exactly the same, but Germany and Switzerland and some Scandinavian countries have some similarities. It's not what you'd call a socialized medicine like in England, where the government controls everything and all the doctors are employees of the government. It's a little bit Germany and Switzerland are a little bit closer to what the accountable care cooperatives would be, but they're still regulated by the government. And I think that's a problem to be regulated by the government. They should be regulated by the board of directors and the administrators elected to regulate the cooperatives.
Do you worry about these cooperatives being so fragmented if we're having thousands of cooperatives across the country without a single unifying thread? And you mentioned problems certainly with government regulations, but if each of them were regulated individually, would you worry about fragmentation of care?
I don't think that would be a problem. I mean, I think physicians read the literature and they have a sense of what works and what doesn't work. They're not all just guideline followers. They have to be really. And I think physicians and healthcare workers rebel against having to follow the guidelines that come from the drug companies and Washington, D.C. politicians and the lobbyists that get the guidelines to be what they are. So, with the transparency of collecting data on all the patients, all the interventions, all the outcomes will lead to much better care. Nothing is perfect in healthcare, but it would be way better than our fragmented, expensive system.
Now, it's fair to say that what you're proposing is fairly aspirational because it's going to require a top-down breakdown of what we currently have. Are there any steps that we can take today to slowly move our healthcare system towards what you're proposing?
Slowly. Well, now is the crisis. The government was shut down over funding, not over the quality of care, not over issues that practicing healthcare workers are depressed and burn out over. That's of lesser consequence than the cost of healthcare. So I don't think a slow fix is is going to work. I mean, if you're talking about years, even months, now is the time to get this into the conversation of the country, of healthcare workers, of patients, that there is an alternative to just what the Republicans want, the Democrats want, which is really inconsequentially different. This can be truly bipartisan, and nothing but a bipartisan fix would ever get through Congress. So we need a bipartisan fix right now.
In our current political climate where both parties are so polarized against one another, do you see a bipartisan fix being a realistic path going forward?
That's the only fix. I mean, that you can't have a Democrat, or a Republican fix to the situation. The Democrats would leave in Obamacare, the Republicans would take it out. These are relatively small compared to the whole failure of the current system. So that just getting this concept into the conversation is right now is my goal. And I don't have all the answers. There can be lots of other input into how to do this well.
We're talking to David Cundiff, physician, author, and healthcare reform advocate. Today's Kevin MD article is Accountable Care Cooperatives, a community owned healthcare fix. David, let's end with take-home messages that you want to leave with the Kevin MD audience.
Thank you. Thank you for the opportunity. Our healthcare system is in a crisis right now, like it's never been in before to this degree. It's the time that a radical change in the way healthcare is delivered and paid for is possible. It wouldn't have been possible without this crisis. And so I hope that you will look into this possibility and talk it up in your social circles and with your politicians. Thank you very much.
David, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thanks again.